A worldwide growing health concern is type 2 diabetes. Did you know that there's a diagnosable condition which is the leading risk factor for type 2 diabetes? This condition is called prediabetes. It can be diagnosed through a simple blood test, but it is estimated that 90% of people with prediabetes do not even know they have prediabetes. My name is Samantha Gogetz from Penn State Extension, and I will be discussing this diagnosable condition. What is diabetes? Diabetes is a disease where the blood glucose level is too high. Glucose enters the body and into our blood from food, which will be discussed later, and used as energy. It is important to be concerned about how much glucose is in your blood. What is prediabetes? It's when there is too much glucose in the blood, but the level of blood glucose is not high enough to be diagnosed as diabetes. The more it continues to rise outside of the normal level, the more likely you will develop prediabetes and possibly progress to type 2 diabetes. Research has found that 70% of people with prediabetes will develop type 2 diabetes in the future. A hormone made in the pancreas, insulin, helps glucose move from the blood into our cells, where it is burned for energy. When the body does not make enough insulin or use insulin properly, called insulin resistance, it is known as type 2 diabetes. When the body does not make any insulin at all, it is known as type 1 diabetes. Throughout this presentation, when discussing diabetes, it will be referring to type 2 diabetes. Because type 1 diabetes is not preventable through lifestyle changes, prediabetes is not a risk factor for type 1 diabetes. If the amount of glucose in the blood continues to rise, prediabetes may develop into diabetes and/or increase the risk of other health problems such as heart disease and kidney disease. Because these conditions occur within the body, you will not be able to look at a person's physical appearance and know that they have prediabetes. But there is a way your doctor can find out if you have prediabetes. There are specific risk factors your doctor will assess to decide if testing for prediabetes or diabetes is needed. These risk factors include age, ethnicity or race, weight, family history of diabetes, or history of diabetes during pregnancy, or any other health factors of concern. There are a few tests that can be done by your doctor to know if your blood glucose level is high, low, or normal. The tests that may be done by your doctor include oral glucose intolerance test, fasting plasma glucose, and A1C. These tests are used to find out what the blood glucose level is and if someone is at risk of type 2 diabetes based on the test result. These tests are also used for diagnosing prediabetes and type 1 diabetes. This chart shows what the levels are for each test to be diagnosed with prediabetes. By knowing your numbers for these tests, you can make changes to eliminate prediabetes or prevent it from progressing into diabetes. How can you make changes to stay healthy? You can eliminate prediabetes or prevent it from progressing into diabetes by eating a balanced diet, exercising, losing weight, and by taking certain medications. How can these help you stay healthy? Let's look at them individually. A balanced diet should be followed to stay healthy. This includes fruits and veggies, whole grains, fat-free or low-fat dairy, lean meats, and certain kinds of oils such as olive, canola, and vegetable, and nut butters like peanut or almond butter. Need help keeping track of which foods you have eaten from each food group? Keep track using your cell phone or write them down in a journal. You can then share that information with a registered dietitian, nutritionist, or other healthcare provider to work together to find an eating plan that works for you. You may be advised to keep track of your carbohydrates, also called carbs, by counting carbs. You may also receive information on how to reduce the calories in your meals to allow weight reduction. Foods that contain carbohydrates affect blood glucose levels. As carbs are digested, they are broken down into blood glucose. Carbs cause blood glucose to rise, which is why those with prediabetes and diabetes must control their carb intake. There are a variety of foods and beverages that contain carbs, but some choices are healthier than others. The food groups that contain carbs are fruits, grains, and dairy. Although many veggies are low in carbs, there are starchy veggies that have higher numbers of carbs, such as potatoes, peas, and corn. Some examples of other foods that may contain carbs include candy, baked goods such as cookies, cakes, and pies, and sugary drinks such as soda or fruit juices. These carbs are not the most nutritious choices. Whether the fruit or drink you consume are considered healthy or unhealthy, the total carb intake needs to be controlled to prevent prediabetes and diabetes. Non-starchy veggies are low in calories and carbs. They are considered high-fiber foods. Fiber helps to keep us feeling full and slows down the absorption of sugar in the body, which helps to control blood glucose levels. Examples of non-starchy veggies are carrots, onions, celery, spinach, kale, and cucumbers. It's easy to eat more non-starchy veggies. You can mix them into your omelet or cook them with the meat you are having at your meal. Reduce the amount of meat and cheese in your sandwich and add non-starchy veggies. Use veggies instead of pasta in soups or other traditional pasta dishes like spaghetti, or just eat them as a snack with some hummus or guacamole. Exercise can improve health and lowers the risk of prediabetes and diabetes. The risk of prediabetes increases with inactivity, as this can increase insulin resistance and raise blood glucose levels. This means that inactivity can actually cause the insulin you are producing to be poorly utilized by the body. Because the body uses glucose during exercise to provide energy, blood glucose levels will decrease with physical activity. If you're not already doing some kind of exercise, you can begin by taking a walk. Grab a friend during your lunch break or go for a stroll around your block after work. Try using the stairs instead of the elevator. If you have stairs in your home or building, try spending 15 minutes going up and down. Or park further away from the store or your worksite to get some more exercise. Better yet, walk there instead of driving. Dancing is a great exercise. You do not need to be a professional dancer to dance. You can dance anywhere. If you do not like dancing in front of other people, dance at home. While watching TV, turn on some music and dance during commercials. During a 30-minute show, you can get about 10 to 12 minutes of exercise. You do not need to go to the gym to get a great workout. As you heard, exercise can be done anywhere. The risk of prediabetes can be changed by just a small amount of weight loss. Weight loss improves the efficiency and action of the insulin you produce. About 10 or 15 pounds makes a difference. Changing the way you eat and getting more exercise, as I've already talked about, can help you lose any extra weight you may have. You may need medication to help you lower your blood glucose level. Your doctor may give you a medication, like metformin, to lower your blood glucose level. Metformin works by reducing the amount of glucose made and released by the liver, and by making the body less insulin resistant. Be aware that some medications you may be taking, such as steroids, can even raise blood glucose. An example of one of these is called prednisone. If you are taking this medication and are concerned about your blood glucose level, talk to your doctor about changing this medication or having monitoring done to screen for high blood glucose during the treatment period. Even with making the changes previously mentioned, people can still develop diabetes in the future. This does not mean you have failed. By making these changes to your lifestyle, you will be much more prepared to prevent the development of diabetes and for the challenges of managing if it occurs. Thank you for viewing this presentation, and I hope you have learned new information to help you live a healthy life.